A crisis is a sudden and temporary state of emotional and psychological imbalance triggered by a significant external event distinct from chronic mental health conditions or trauma. Unlike chronic conditions, which persist over time, a crisis requires immediate intervention due to its acute nature and the overwhelming impact on an individual's ability to cope. While crises and trauma share similarities, such as the sense of threat and emotional distress, they do differ diagnostically and in duration. Crises are typically transient, involving immediate disruption, where trauma often stems from prolonged or extreme stress, leaving lasting psychological effects that can result in conditions like PTSD. The effects of a crisis are evident in cognition, emotions, and behavior. Cognitively, individuals may struggle with concentration, rational decision making, or clear thought processes. Emotional responses can range from intense fear, anxiety, or anger to feelings of helplessness. Behaviorally, some people may exhibit impulsive or hyperactive reactions, while others may withdraw or shut down emotionally. These responses are the mind and body's way of attempting to navigate the perceived threat and restore balance, though they often leave the individual vulnerable during the crisis. Coping mechanisms during a crisis can be adaptive or maladaptive. Adaptive strategies such as seeking support, problem solving, or grounding techniques can help individuals regain a sense of control and stability. However, maladaptive strategies, including avoidance, aggression, or substance use, may worsen the situation and hinder recovery. Identifying these coping patterns is critical in guiding individuals towards healthier approaches to managing their distress. Cultural factors also play a significant role in shaping how individuals perceive and respond to a crisis. For example, in collectivist cultures, individuals may prioritize the needs of their family or community over their own, influencing their coping strategies and help seeking behaviors. Incorporating culturally responsive assessment practices ensures that interventions are effective and empathetic, tailored to the individual's unique context. Understanding these immediate effects, along with distinctions between crisis and trauma, creates a foundation for comprehensive and compassionate care. Individual characteristics such as temperament and personality traits play a significant role in shaping how people respond to crises. For example, an extroverted individual might seek social connection and verbalize their distress, finding comfort in external interactions, while an introverted person may withdraw, needing quiet time to process their emotions internally. Similarly, individuals with high levels of emotional stability may remain calm and problem focused in a crisis, whereas those with lower emotional regulation might exhibit heightened anxiety, impulsivity, or difficulty coping. These personality driven differences influence not only how the crisis is experienced, but also how intervention should be tailored to meet the individual's needs. Mobilizing internal and external resources is a critical component of effective crisis intervention. Internally, coping skills such as mindfulness, problem solving, and emotional regulation can help individuals regain a sense of control and direction. Externally, support systems, friends, family, community resources, or professionals provide essential emotional and practical assistance. For instance, an individual with a strong social network may have immediate access to reassurance and guidance, which can mitigate feelings of isolation and overwhelm. Conversely, those lacking such support may require additional help to identify and access community resources such as counseling service or crisis hotlines to address their needs. Temperament also impacts the diagnostic and treatment process during a crisis. Individuals with a detail-oriented, logical approach may benefit from structured interventions that clearly outline steps and goals, helping them feel grounded. On the other hand, those with a more intuitive or emotional focus may respond better to interventions emphasizing empathy, validation, and meaning making. A mismatch between temperament and intervention style can lead to frustration or reduced engagement, highlighting the need for flexible, personalized approaches. Furthermore, cultural background influences temperament expression, underscoring the importance of cultural competence in assessing and responding to crisis related behaviors. Understanding these individual differences allows counselors to provide more precise, supportive care that aligns with each person's unique coping style and resources. Crises, while inherently distressing and disruptive, can also serve as a powerful turning point that fosters personal growth, resilience, and a broader sense of wellness. They challenge individuals to reevaluate their circumstances, confront vulnerabilities, and in some cases emerge stronger and more self-aware. This concept, known as post-traumatic growth, highlights the positive psychological changes that can arise from struggling with adversity. Rather than merely returning to a baseline level of functioning, individuals experiencing post-traumatic growth often report shifts in their worldview, such as deeper appreciation for life, improved relationships, enhanced personal strength, spiritual development, and a renewed sense of purpose. For example, someone recovering from a health crisis may develop a passion for advocacy or discover a new clarity about their values that reshapes their priorities. Crises provide a diagnostic window into underlying conditions that may emerge or intensify during moments of acute distress. These situations can reveal patterns of behavior, coping mechanisms, and emotional responses that might not otherwise come to light. For counselors, this offers a valuable opportunity to identify both challenges and strengths, creating a pathway towards more holistic and effective treatment planning. Instruments like the Post Traumatic Growth Inventory allow clinicians to measure these positive changes, assessing areas such as personal strength, spiritual growth, and appreciation for life. These tools not only capture the outcomes of growth, but also provide a structured way to align therapeutic goals with the individual's emerging strengths and insights. A strength based approach to diagnosis is critical in transforming a crisis into a growth opportunity. This perspective shifts the narrative from one pathology and deficit to one of resilience and potential. An integral part of this approach involves examining the 8 dimensions of wellness: physical, emotional, social, intellectual, environmental, spiritual, vocational, and financial. By assessing those areas during crisis intervention, counselors can identify unmet needs or areas of strength that may inform treatment. For instance, a client may demonstrate strong vocational stability, but struggle with emotional resilience or financial stress. Understanding these wellness dimensions offers a comprehensive view of the individual's life, allowing for tailored interventions that promote balance and recovery across all domains. Wellness also serves as a framework for identifying growth opportunities. By fostering hope and helping clients recognize their capacity for adaptation and change, clinicians can help guide individuals towards a more fuller and more integrated sense of health and well-being. Crises, while undeniably challenging, can become profound moments of transformation, illuminating paths towards healing, growth, and a renewed commitment to living well in all aspects of life. This dual focus on addressing immediate distress and facilitating long-term wellness underscores the power of seeing crises not only as disruptions, but also as opportunities for positive change and holistic growth. Crises are multifaceted events that can arise from a variety of sources, including situational, developmental, and existential challenges. Situational crises are unexpected events such as natural disasters, sudden losses, or traumatic incidents that disrupt an individual's sense of stability. Developmental crises, in contrast, are tied to a predictable life transition such as adolescence, marriage, or retirement, which may feel overwhelming due to the psychological, social, or environmental demands that they bring. Existential crises often emerge from internal struggles related to meaning, purpose, or identity, particularly during periods of significant change or reflection. Research indicates that these types of crises can overlap, creating a layered experience of distress that requires nuanced understanding and intervention. Co-occurring mental health or substance use disorders can further complicate crisis scenarios, increasing the intensity of emotional responses and impairing coping mechanisms. For instance, individuals with untreated depression or anxiety may experience heightened feelings of hopelessness or fear during a situational crisis, while those with substance use disorders might turn to maladaptive coping that exacerbate the situation. According to the Substance Abuse and Mental Health Services Administration, or SAMHSA for short, co-occurring disorders often mask or amplify the symptoms of a crisis, making accurate assessment and treatment more challenging. So it's important to develop a diagnostic approach that addresses both the immediate crisis and the underlying conditions. The complex nature of crises also stems from the interplay of individual, social, and systemic factors. SAMHSA emphasizes that factors such as socioeconomic status, cultural background, access to healthcare, and social support networks significantly influence how individuals experience and respond to crises. For example, individuals from marginalized communities may face additional barriers such as systemic discrimination or lack of access to resources that intensify the impact of a crisis. Similarly, chronic stressors like poverty or ongoing exposure to violence can create a cumulative effect, making individuals more vulnerable to crisis events and complicating recovery. Comprehensive assessments play a critical role in untangling the complexity of crises. These assessments must go beyond identifying immediate stressors to include a thorough evaluation of the individual's mental health, substance use history, social environment, and coping resources. Tools like the Mental Health Crisis Assessment Tool can help clinicians systematically evaluate the severity and scope of a crisis, identify risk factors, and prioritize interventions. SAMHSA's guidelines for crisis service emphasize the need for culturally and developmentally appropriate assessments that account for diverse ways individuals experience and express distress. For example, an individual's cultural background might influence their willingness to disclose emotional pain or the strategies they view as acceptable for coping. Moreover, comprehensive assessments allow clinicians to identify strengths and protective factors that can be leveraged during interventions. Research shows that individuals with strong social connections, effective problem solving skills, and access to supportive resources are more likely to recover from crises and build resilience. By incorporating these elements into the assessment process, individuals can develop tailored intervention plans that not only assess immediate needs, but also foster long term well being. Effective decision making during crisis intervention requires counselors to prioritize safety and stabilization while addressing the immediate needs of the individual. The choices made during the acute phase of a crisis not only mitigate immediate distress, but also help shape diagnostic outcomes and inform long term treatment planning. By using structured frameworks and evidence based practices, counselors can ensure that both immediate and future needs are addressed comprehensively. One key framework that can guide this process is Maslow's hierarchy of needs, which emphasizes the importance of meeting basic physiological and safety needs before addressing higher order goals such as self actualization. In a crisis, individuals are often operating from the lowest levels of this hierarchy, grappling with the threats to their physical safety, emotional security, or access to essential resources like food, shelter, and sleep. Research highlights the critical role of ensuring that these basic needs are met as a foundation for their effective crisis intervention. For example, SAMHSA underscores that stabilizing individuals physically and emotionally during a crisis is essential for fostering long-term recovery. When counselors address these foundational needs first, it creates stability required to engage in a more complex intervention and diagnostic process. Safety is the cornerstone of crisis intervention. This includes not only physical safety, ensuring the individual is removed from immediate danger, but also emotional safety, which involves creating a supportive and non-judgmental environment. Comprehensive assessments allow counselors to identify the extent of these needs and prioritize interventions accordingly. For instance, individuals experiencing suicidal ideation may require immediate hospitalization or a safety plan, while those facing housing insecurity may need referrals to shelters or social services. By addressing these foundational concerns, counselors can reduce the individual's immediate stress and prepare them to engage in diagnostic and therapeutic processes. Addressing basic needs also includes focusing on essential self-care practices such as sleep and nutrition, which are often disrupted during a crisis. Sleep deprivation, in particular, can exacerbate emotional dysregulation and impair cognitive functioning, making it more difficult for individuals to process their experiences and participate in treatment. Encouraging restorative sleep and addressing barriers to self-care can help individuals regain a sense of control and readiness to address more complex issues. Research shows that simple interventions such as psychoeducation on sleep hygiene and relaxation techniques can have meaningful impacts on crisis recovery. Innovative approaches can also play a role in addressing the immediate psychological effects of a crisis. For example, there's a study from 2009 that demonstrated that playing Tetris shortly after a traumatic event can reduce the likelihood of intrusive memories, suggesting that engaging in visually and cognitively demanding tasks can disrupt the brain's consolidation of distressing experiences. Such evidence based strategies can complement traditional stabilization efforts, offering additional tools for counselors to use during acute interventions. And as the crisis stabilizes, counselors must help individuals begin to explore longer term goals, aligning immediate interventions with the broader diagnostic and treatment plan. Choices made during the acute phase of a crisis, such as initiating substance use treatment alongside psychiatric care, can reveal underlying conditions and guide comprehensive treatment. Furthermore, counselors should adopt strength based approaches focusing on the individual's resilience and resources. By identifying and building upon these strengths, counselors can foster a sense of empowerment and self-efficacy, essential components for recovery and growth. Incorporating Maslow's hierarchy into the crisis intervention process also aligns with the need to address the complexity of human emotions and experiences holistically. Crises often disrupt multiple areas of wellness, including physical, emotional, social, vocational, and financial dimensions. Counselors can use assessments such as SAMHSA's 8 Dimensions of Wellness framework to identify unmet needs and areas of strength across these domains. This approach ensures that interventions are tailored to the individual's unique context and priorities, creating a pathway towards comprehensive recovery. And external factors such as socioeconomic stressors, trauma histories, or systemic inequities can significantly intensify the experience of situational crisis. These factors may exacerbate the individual's sense of instability or overwhelm, further complicating their path to recovery. For example, financial insecurity following job loss or ongoing psychological toll of systemic discrimination can amplify feelings of powerlessness. Understanding these contextual influences is vital when forming differential diagnoses and treatment plans, as they provide a more comprehensive view of the individual's current challenges. When addressing these factors, it's essential to adopt a non-pathologizing perspective that recognizes natural responses to extreme situations without over-diagnosing or mislabeling. Gestalt therapy provides a valuable framework for this approach by focusing on the individual's lived experience in the here and now. This perspective avoids reducing a person's experience to a set of symptoms and instead sees their reactions as meaningful and interconnected with their environment. From a Gestalt lens, situational crises are not failures, but opportunities for increased self-awareness and integration. For instance, a Gestalt-oriented approach might explore how an individual's response to job loss is tied to their broader life narrative, including patterns of self-perception, unmet needs, and relational dynamics. Rather than focusing solely on the distress, this exploration can help to uncover paths for growth and alignment with their authentic self. In this way, the counselor's role becomes one of a compassionate facilitator who helps clients reconnect with their inherent resources and capacities for resilience. This often involves addressing both external stressors like economic strain or societal pressures and internal processes such as emotional regulation and coping mechanisms. A Gestalt therapist might explore the sensations, emotions, and thoughts arising for the client, helping them notice how they engage with their environment and relationships during the crisis. This collaborative process encourages clients to take ownership of their experience and empowers them to co-create solutions that feel authentic. Gestalt therapy's non-pathologizing view aligns with the trauma-informed practices, emphasizing that the client's response to their environment is a natural reaction rather than a personal failing. Fritz Perls, the father of Gestalt therapy, succinctly captured this ethos in his quote, "Awareness per se, by and of itself, can be curative." So the idea here is that by fostering awareness both of the internal and external dynamics of a crisis, counselors can help clients identify areas of strengths and potential for growth, shifting the narrative from crisis as a catastrophe to crisis as a turning point. This integrative approach not only reduces the risk of over-pathologizing, but also reinforces the counselor's focus on understanding the client holistically. By considering external stressors, leveraging the Gestalt's therapy emphasis on present moment awareness, and fostering resilience, counselors can support clients in navigating crises in a way that honors their humanity and promotes healing. Cognitive distortions are pervasive thought patterns that can emerge or intensify during a crisis, shaping how individuals perceive and respond to their circumstances. These distortions often skew reality, amplifying distress and influencing both symptom presentation and diagnostic accuracy. Common distortions include catastrophizing, where individuals imagine the worst possible outcomes, and black and white thinking, which simplifies complex behaviors into binary extremes, such as total failure versus complete success. For example, a client who has recently lost their job may catastrophize, believing that they will never find employment again, which can exacerbate anxiety or depressive symptoms. Similarly, black and white thinking might lead to a rigid all or nothing evaluation, such as seeing themselves as entirely worthless due to a single setback. The presence of these distortions during crisis complicates the diagnostic process. Symptoms like heightened anxiety, irritability, or withdrawal can resemble those of generalized anxiety disorder, major depressive disorder, or even post-traumatic stress disorder. However, these symptoms may instead reflect temporary cognitive responses to acute stress rather than enduring psychopathology. Comprehensive assessment and diagnostic clarity require counselors to identify these distortions and explore their role in symptom formation. Tools such as the Beck Depression Inventory or Beck Anxiety Inventory, which align with cognitive behavioral frameworks, can help quantify cognitive and emotional impacts while distinguishing transient distress from chronic conditions. Addressing cognitive distortions during crises is vital for symptom stabilization and setting the stage for accurate diagnosis. Brief cognitive behavioral techniques, or CBT therapy, is particularly effective for this purpose. So, for example, cognitive restructuring can help clients identify and challenge distorted thoughts. A client who catastrophizes about their financial situation might be guided to evaluate evidence for and against their fear of irreversible poverty, leading to a more balanced perspective. Similarly, thought-stopping techniques can disrupt repetitive, unhelpful thinking patterns, while mindfulness exercises can anchor clients in the present moment, reducing the grip of catastrophic or polarized thoughts. The cognitive behavioral lens emphasizes the interconnectedness of thoughts, emotions, and behaviors, offering a framework for understanding how distorted thinking perpetuates crisis-related distress. For example, clients who engage in overgeneralization or extrapolating a single negative event into a global pattern might feel demoralized and withdraw socially, further exacerbating their isolation. By identifying these patterns and intervening early, counselors can prevent escalation of symptoms and foster adaptive coping strategies. Research supports the efficacy of cognitive behavioral interventions in crisis situations. And there was a study in 2006 that demonstrated the effectiveness of cognitive behavioral techniques in reducing acute stress responses and preventing the development of chronic post traumatic stress disorder. Similarly, Beck in 1979 highlighted the role of cognitive restructuring in mitigating depressive symptoms during periods of heightened stress. These findings underscore the importance of equipping clients with tools to challenge cognitive distortions as part of crisis intervention. And from a diagnostic perspective, addressing cognitive distortions not only stabilizes symptoms, but also reveals a clearer picture of the client's mental health. Once immediate distortions are mitigated, counselors can more accurately assess whether underlying conditions such as anxiety or depressive disorders are present. Moreover, incorporating cognitive behavioral techniques into treatment planning provides clients with lifelong skills to manage future crises, enhancing resilience and reducing the likelihood of reoccurrence. Effective crisis intervention techniques serve as the foundation for managing acute crises, stabilizing individuals, and clarifying the path for accurate diagnosis and treatment planning. These techniques aim to de-escalate high-intensity emotional responses while creating an environment where safety, trust, and constructive problem-solving can take place. Grounding, de-escalation, and supportive communication are evidence-based strategies widely used in crisis scenarios to achieve these objectives. Grounding techniques are particularly useful in reducing overwhelming emotional states and helping individuals reconnect with their present moment. For example, guiding somebody to take slow, deliberate breaths not only fosters a sense of calm, but also activates the parasympathetic nervous system, countering the fight or flight response. Harvard researchers have highlighted the roles of activities like chewing gum in stimulating the vagus nerve, which promotes relaxation. Encouraging individuals to focus on their sensory experiences, such as naming objects they see, hear, or touch, can further anchor them in the present, mitigating intrusive thoughts or dissociative symptoms. De-escalation strategies prioritize creating safe and non-threatening environments. Crisis situations often involve individuals who feel powerless and out of control. A calm and empathetic presence is essential to establish trust and foster collaboration. For instance, avoiding invalidating phrases like calm down, critical. Instead, acknowledging the individual's emotional state with statements like, I can see this is really overwhelming for you and I want to help, can go a long way in validating their experience. Physical positioning also plays a role. Standing over someone can be perceived as intimidating, whereas sitting on the same level conveys equality and respect. Supportive communication involves active listening and collaborative problem solving. Allowing individuals to share their story without interruption or judgment is key. Their narrative provides insights into the crisis origins and the cognitive distortions it may be fueling. Common distortions such as catastrophizing or black and white thinking can escalate emotional intensity and complicate the diagnostic process. Helping the individual reframe these thoughts, such as shifting, this is complete disaster, to this is really difficult, but there are steps that we can take, empowers them to regain perspective and control. Integrating these techniques into the diagnostic process is crucial. Intermediate intervention can prevent symptoms from escalating, enabling a clearer view of the individual's mental state. For example, grounding techniques may reduce hyperarousal, allowing the clinician to distinguish between acute stress responses and underlying conditions like generalized anxiety disorder or post-traumatic stress disorder. De-escalation provides space for meaningful dialogue, which is essential for collecting accurate diagnostic information. The importance of basic self-care decisions during a crisis cannot be overstated. Sleep, hydration, and nutrition are foundational to emotional regulation and cognitive functioning. For example, research on the use of Tetris after trauma suggests that engaging in specific cognitive tasks shortly after a traumatic event can disrupt the consolidation of traumatic memories, reducing the risk of developing PTSD. Encouraging clients to attend to their physical well-being not only aids in immediate stabilization, but also supports long-term recovery. Maslow's hierarchy of needs provides a guiding framework for prioritizing intervention efforts during crises. As counselors, ensuring that an individual's basic needs such as safety, shelter, and food are met is a prerequisite to addressing higher-order concerns like self-esteem or emotional growth. Without this foundation, any attempt to address complex psychological issues may falter, as the individual's energy remains focused on survival. Finally, documenting intervention outcomes is an integral part of effective crisis management. Thorough records help track a client's response to specific techniques, ensuring continuity of care and facilitating collaboration among professionals. Documentation also serves as a tool for identifying patterns, refining diagnostic impressions, and evaluating the effectiveness of interventions over time. In sum, crisis intervention techniques blend grounding, de-escalation, and supportive communication to stabilize individuals and set the stage for accurate diagnosis and recovery. These stages honor the immediate needs of safety and empowerment while aligning with long-term goals of fostering resilience and growth. By attending to both the psychological and practical aspects of a crisis, counselors create a path towards resolution that is both compassionate and effective. Culture encompasses the shared values, beliefs, customs, behaviors, and societal norms that shape an individual's worldview and experiences. It influences every aspect of how people interpret and respond to life events, including crisis. While often equated with race or ethnicity, culture extends far beyond these factors. And I really like using the addressing model as a framework for understanding the breadth of cultural influences, and it highlights the importance for considering multiple intersecting identities. Each element of this model underscores how diverse cultural dimensions can shape an individual's experience of crisis and their path towards resolution. So, starting with the A in addressing, it stands for age and generation. Different age groups experience and express crises uniquely. For example, older adults who lived through economic depressions or wars may display stoicism and a reluctance to seek help, valuing self reliance as a survival mechanism. In contrast, younger generations may be more inclined to seek support through digital platforms or social media, reflecting generational shifts in communication and coping strategies. The D stands for developmental disability, and individuals with developmental disabilities may face unique barriers during crises, such as difficulties with verbal communication or reliance on caregivers who may be also experiencing distress. For example, during natural disasters, people with developmental disabilities often face heightened vulnerability due to evacuation challenges or disruptive support systems. The second D stands for disability acquired. So, acquired disabilities such as physical impairments from an accident can amplify crisis experiences. For example, during the COVID-19 pandemic, individuals with acquired disabilities often reported increased isolation and difficulty accessing healthcare, compounding their stress and mental health challenges. R stands for religion and spirituality. Religious or spiritual beliefs significantly influence how individuals frame and cope with crisis. For example, a person from a Christian tradition might find solace in prayer and community fellowship, while somebody practicing Buddhism might use meditation and mindfulness to process their distress. In times of collective crisis, such as terrorist attacks or natural disasters, religious groups often provide communal support, highlighting the role of spiritual communities in fostering resilience. E is for ethnicity and race, and ethnic and racial identities profoundly affect crisis experiences due to systemic inequities and historical trauma. For example, Black and Indigenous communities in the United States often report higher levels of mistrust in emergency services or healthcare systems due to historical mistreatment. And this mistrust can hinder access to timely crisis intervention and perpetuate disparities in mental health outcomes. And the first S is for socioeconomic status. So financial instability often exacerbates crises by limiting access to resources and supports. For instance, individuals in lower socioeconomic brackets are disproportionately affected by housing crises or natural disasters, as they may lack savings, insurance, or access to recovery programs. The stress of navigating these barriers can intensify emotional and psychological distress. The second S is for sexual orientation. LGBTQ plus individuals often face unique stressors during crises such as discrimination or lack of acceptance in shelters or healthcare settings. For example, during the aftermath of Hurricane Katrina, reports highlighted the exclusion of LGBTQ plus individuals and families from some relief efforts, emphasizing the importance of inclusivity in crisis planning. N stands for national origin and language. Immigrants and refugees may face compounded challenges during crises, including language barriers and unfamiliarity with local systems. For instance, during public health emergencies, non-native speakers may struggle to access timely and accurate information, increasing their vulnerability. Undocumented individuals may also fear seeking help due to concerns about legal repercussions. And the G stands for gender. Gender roles and expectations can influence how individuals experience and respond to crisis. For example, women may face heightened risks of domestic violence during crisis, like economic downturns, while men may feel societal pressure to suppress emotional expression, impacting their ability to seek support. And then this last one doesn't fit in the addressing mnemonic, and I think it was added after the original article was published. But another culture that you might want to consider is military or veteran culture. Veterans and active duty military personnel may face crises related to re-entry in civilian life, PTSD, or loss of camaraderie. But this isn't an exhaustive list. This is just a start to have you thinking about culture as something more broad than race and ethnicity only. And where I work, I also often consider the culture of whether my clients in addiction recovery are engaged in 12-step meetings or not, because that brings an extra cultural consideration with it, which may or may not be tied to their spirituality. So, by understanding and applying the addressing model, counselors can better grasp the diverse ways in which cultural factors influence crisis experiences. Recognizing these intersecting identities ensures that interventions are tailored, equitable, and inclusive, providing individuals with the culturally attuned support that they need to navigate and recover from crises. Conducting a comprehensive crisis assessment is a vital component of effective intervention, providing a foundation for accurate diagnosis and tailored treatment planning. This process requires a systematic approach to understanding the multifaceted nature of crises, including their immediate impact, underlying causes, and potential for long-term effects. A well-rounded assessment evaluates risk factors, protective factors, and presenting symptoms while integrating insights across physical, emotional, cognitive, social, and spiritual domains. The first step in crisis assessment is to evaluate risk factors, which may include the severity of the crisis, the individual's prior history of trauma, the presence of co-occurring mental health or substance use disorders, and immediate threats to safety such as suicidal or homicidal ideation. Tools like the Columbia-Suicide Severity Rating Scale are valuable for assessing suicide risk, helping clinicians identify individuals in acute distress and prioritize safety measures. Similarly, the Brief Addiction Monitor can be used to assess substance use behaviors that may contribute to or exacerbate the crisis. Protective factors are equally important to consider as they highlight an individual's strengths and resources that can help be leveraged during treatment. These may include the presence of supportive relationships, personal coping skills, access to spiritual or religious resources, and prior resilience in the face of adversity. The Resilience Scale for Adults is an assessment tool that can help you identify these protective factors and guide the development of a strengths-based treatment plan. Assessing presenting symptoms involves a thorough evaluation of physical, emotional, and cognitive responses to the crisis. Physical symptoms such as changes in sleep or appetite may signal underlying conditions or exacerbate the individual's distress. Emotional symptoms, including heightened anxiety, anger, sadness, often overlap with cognitive distortions such as catastrophizing or black and white thinking. The Patient Health Questionnaire 9, or PHQ-9, is a widely used tool to assess depressive symptoms and their severity, while the Generalized Anxiety Disorder 7 can provide insight into anxiety levels. Social and environmental factors can also play a significant role in crisis assessment, identifying gaps in social support, systemic barriers, or environmental stressors such as housing instability or job loss can inform targeted interventions. The Social Connectedness Scale Revised and community assessment tools are resources for evaluating an individual's social environment and identifying areas where support can be bolstered. Spiritual factors, including a person's sense of meaning, purpose, or connection to higher power, may provide critical insights into their coping mechanisms and sources of hope. The Spiritual Wellbeing Scale is an assessment tool that can help explore this domain, particularly for individuals who rely on spiritual practices as a key component of resilience. The integration of these assessments allows counselors to develop nuanced understanding of the individual's experience and form accurate, individualized diagnoses. For example, distinguishing between post-traumatic stress disorder and adjustment disorder may hinge on identifying specific trauma triggers and assessing symptom duration and intensity. Similarly, comprehensive assessments can clarify the role of situational stressors versus underlying mood or anxiety disorders, preventing misdiagnosis and ensuring appropriate care. In addition to individual assessments, crisis assessment often involves collaboration with other professionals to gather collateral information and ensure holistic understanding of the client's needs. This process might include consulting with family members, reviewing medical records, or working with case managers and community resources to address immediate safety concerns. While this lecture is just introducing the foundational aspects of crisis assessment, you'll explore this later and learn all about the specific tools and methods in greater detail in your upcoming assessment course. Familiarity with these tools now provides a head start, emphasizing the importance of a comprehensive, client-centered approach that integrates diverse aspects of a person's identity and experiences into the diagnostic process. Understanding crisis is a foundational aspect of effective counseling, as these moments of acute distress impact emotional, cognitive, physical, social, and spiritual aspects of a person's life. Crises can stem from situational stressors, developmental transitions, or unresolved past experiences, and each client's response will be unique. As counselors, recognizing and respecting these individual differences is crucial to providing care that is both accurate and supportive. A comprehensive crisis assessment ensures that interventions are tailored to the client's needs, helping to clarify whether symptoms reflect a normal stress response or a diagnosable condition. This lecture explored key elements of crisis diagnosis and intervention, starting with the need to address cognitive distortions like catastrophizing and black and white thinking. These thought patterns often arise during crises, can intensify emotional distress or interfere with decision making. I also highlighted the importance of culturally responsive care using frameworks like the addressing model to help counselors understand and honor diverse factors influencing a client's experience. Approaches like grounding, de escalation, and supportive communication were discussed as strategies to help clients stabilize and engage meaningfully in the diagnostic process. Trauma informed care emerged as a central theme, reinforcing the importance of approaching clients with empathy and understanding while avoiding practices that might re traumatize or alienate them. In crisis scenarios, assessment is not just about identifying challenges, it's also about uncovering strengths and protective factors. The idea of post traumatic growth offers a perspective that helps clients see crises as opportunities for recovery and resilience building rather than solely obstacles. In summary, counselors play a pivotal role in helping clients navigate the challenges of crisis and using these moments to guide accurate diagnosis and effective intervention planning. Viewing crises as opportunity for growth encourages both clients and counselors to identify strengths, set meaningful goals, and foster long-term well-being. By grounding our work in evidence-based, trauma-informed, and culturally responsive practices, we can provide the thoughtful and individualized care that every client deserves. And to deepen your understanding of counseling for crises, on this slide, I've added some recommended resources. Feel free to reach out to me if you have any questions.